what I want to bring you today is some information on what we have uncovered in Shelby County, because the people of Shelby County deserve efficient and effective vaccinations. It is our largest population center. It is also one of our centers of color as far as disadvantaged and minority communities. But the people of Shelby County deserve to have good access to vaccine. And so this is all about solving problems and making sure that they have that access. This is not about laying blame or pointing fingers. So I do want to start out by telling you that, like you, we have heard reports over the last few weeks of some concerns and some inefficiencies. You've heard me reference in this venue before that we have been working with them, not only the Shelby County Health Department, but more directly with the city of Memphis within the last week or so. We have provided some enhanced reporting as it pertains to doses being delivered. We've been working offline and in the background on this issue. However, as you know, on Friday, February 19th, there was a public report that over 1,000 doses were wasted after being expired in the pharmacy at the Shelby County Health Department. That was very concerning to us. That was new information to us. And so we immediately deployed a team to Shelby County that included our director of our vaccine program, director of emergency preparedness, as well as a lead member of our unified command group. When we got there, we did find the 1,315 doses that were reported to be expired. I do want to pause and give you a little bit of clarity on some of these numbers that I'm going to be giving you. You may remember that several days ago, maybe a week or two ago now, Pfizer changed their packaging to where the vial each now has 6 doses instead of 5. So this 15 doses is based on 5 doses per vial. If you use the 6 doses per vial, which is now the official count in those vials, that amounts to 1,578 doses. We found that we first found that those 1,600 or so doses, 1,578, happened over 6 expiration events dating back to February 3rd. I recognize that there has been some weather statewide, but specifically in the West Tennessee area, even prior to the storms, the snowstorms in Middle Tennessee and the rest of West Tennessee this past week, the weather events in Shelby County and in West Tennessee were earlier than some of the rest of the states. However, that went back to the 11th or the 12th. That did not go back to the 3rd. So we believe that the majority of this wastage was not weather related, that it was actually 6 different expiration events that occurred between February 3rd and February 12th to total, again, 1,315 or 1,578 with 5 and 6 doses respectively. The other thing that it is not related to, they were not doses that were taken out into a site and then people no-showed and they had to bring back. These were doses that, for what we understand right now, never left the pharmacy and were allowed to expire on site there. The other thing that we found when we came on site is we found 51,000 doses in inventory. Now, I want to put that in context for you because some inventory is expected. You have to be able to plan ahead about a week in advance, even a little bit longer, perhaps up to 10 days for those getting ready to get a second dose. By our calculations, we are estimating that they should have had about 20,000 doses in inventory. And so when we found 51,000, again, that's using 6 doses per vial, we found an excess of 30,000 doses on the shelf in Shelby County Health Department. These doses, fortunately, were not expired, and the earliest expiration date of these excess 30,000 doses is March 6th. So we still have a couple of weeks to use up that inventory. When we were on site last Friday, we also found a lack of standard operating procedures for storage and handling of vaccine. We found no formal process for management of soon to expire product. And we also found that there was no ability for Shelby County Health Department personnel to access the pharmacy in their own building. So to explain that relationship, as I understand it, that is a contract pharmacy or pharmacist that Shelby County employs. It is embedded in the health department. That pharmacist is technically an employee of a health system, but is assigned exclusively to Shelby County Health Department and has worked there for quite some time. We understand that the pharmacist had sole access to that pharmacy and that Shelby County Health Department leadership was not able to access that without the pharmacist present. So that was on Friday. Our team arrived on Friday night around 7:30, stayed there well into the evening, and then went back on site on Saturday morning, the 20th. They left mid-morning or late morning on Saturday, and then we returned yesterday on Monday, the 22nd. Yesterday, later in the day, we also discovered that there was a 7th expiration event that occurred on February 15th. That one was weather related. That was Monday of last week when many sites in the state had to close down. That was an additional 850 doses to bring the total, if you use 6 doses per vial, to around 2,400 doses in 7 different expiration events since February 3rd. Unfortunately, that February 15th expiration was not disclosed when we were there on the 19th, but was rather disclosed yesterday on the 22nd. These are the facts as I understand them. I will remind you that this is an ongoing investigation. We have people on site today, and you'll hear more about that in our action items. But again, I want to reiterate, this is not to point fingers or place blame. This is because the people of Shelby County deserve efficient and effective access to this vaccine. And so not only are Shelby Countyans important to us, all of us in the state, but the performance of Shelby County is important to our state's performance as a whole. Shelby County accounts for about 14% of the state's population. And now that we're doing population-based allocation, that means they get about 14% of all of the doses statewide. And so when that is not maximally efficient, it brings the entire state's performance down. But that's not what's important here. What's important here is that people of Shelby County are able to get the vaccine as quickly as possible. So I want to tell you about our action items to date. These could change. They could be added to or taken from as we learn more information. But I first want to reassure you that vaccination efforts in Shelby County are full steam ahead. There is no time that we are taking any sites offline. They're vaccinating today. They are doing it the rest of the week. We are doing everything we can to make sure that those events and those sites remain live and active. And I want to make sure you understand the difference between allocation and administration. They're really two different buckets, although they are related. So all of the issues we're talking about have been in allocation and in the management of that. If you want to think about it, like that's what happens in the office and in the pharmacy. There is another set of issues that happens out in the field where these are actually being administered. And if you don't have a good process for allocation, your delivery of vaccine might not be as efficient as it could be. But right now, we're focusing our efforts on the upstream part of that, which is the management and allocation of the inventory. And then we also understand that there are some issues with some of the sites where vaccine is actually being administered, and that's part of our action plan as well. So our action items include full-time embedding of both Department of Health staff and then soon to be CDC staff on site at Shelby County Health Department. That began yesterday. Our team arrived just after lunchtime yesterday and plan to be there on site for the near term. I suspect that will probably be anywhere from 2 to 4 weeks. We have requested CDC assistants to be on site there for 30 days and are awaiting that personnel to be deployed. Those people that are embedded are subject matter experts. They are pharmacists, they are vaccine management experts in storage and handling, and they are there to provide technical assistance as well as monitoring while we continue this investigation. I'm oftentimes asked, why don't you just take it over and why don't you do it all yourself? That's not the point here. The point here is we don't want to slow Shelby County down. If we were to take everything over, or to get a third party to take everything over, there would be a necessary slowdown, and we don't want that to happen. We want to come alongside. We want to provide assistance as well as education and training on how to move forward. We are also taking the current inventory that is in the Shelby County Health Department and distributing them to partners who can immediately deploy these. You may not be aware, but there are dozens of sites in Shelby County that have vaccine right now and are giving vaccine. I think people get into the mindset that they're only coming from these very large sites, but there are dozens of sites across Shelby County, including pharmacies, hospitals, clinics, as well as both the City of Memphis and the Shelby County Health Department sites. And so all of the inventory that's in Shelby County right now is being taken out, removed from the site, and given to those partners for immediate administration. Again, those excess doses have an expiration date no sooner than March 6th. So we do have a couple of weeks to effectively use those doses. The other thing I want to reassure you is that Shelby County will continue getting the same population-based allocation. We are not reducing the number of vaccines that are coming to Shelby County, but what we are doing is we are no longer sending them to the Shelby County Health Department for the time being, but rather sending them to the other. I'll just ask that everybody mute their lines, please. The primary partner or partners in that mix is the City of Memphis, as well as multiple hospitals, pharmacies, and FQHCs, as well as some safety net clinics. We are, as I mentioned a minute ago, transferring the physical assets out of Shelby County Health Department. And additionally, we are instituting daily phone calls with Shelby County Health Department leadership and our vaccine management, or our vaccine program here at the central office at the Department of Health. That is in addition, as a supplement to the on-site assistance that we're providing. Going forward, there are a couple of other things that you should probably anticipate. We think that it is likely that there will be some type of inquiry from our federal partners, specifically the entity formerly known as Operation Warp Speed, or the CDC, and perhaps other federal agencies that have an interest in this very valuable federal resource. We also, in the process of being embedded down there, will begin to look at how efficiently the sites, the distribution sites where the actual vaccine is being given, how efficiently those are run, and if we can identify any processes that can be improved there. But right now, I want to stress that our primary consideration at this moment is making sure that the vaccines are safe, that they're stored and handled properly,